Hello and welcome to the Medical Sales Podcast. I'm your host, Samuel, founder of a revolutionary medical sales training and mentorship program called the Medical Sales Career Builder, and I'm also host of the Medical Sales Podcast. In this podcast, I interview top medical sales reps and leading medical sales executives across the entire world. It doesn't matter what medical sales industry, from medical device to pharmaceutical to genetic testing and diagnostic lab, you name it, you will learn how to either break into the industry, be a top 10% performer within your role, or climb the corporate ladder. Welcome to the Medical Sales Podcast. And remember, I am a medical sales expert sharing my own opinion about this amazing industry and how it can change your life. Hello and welcome to the Medical Sales Podcast. I'm your host, Samuel, and today we have a fantastic guest, and she goes by the name of Gina Torres. Now, Gina is a peripheral vascular rep doing amazing things in the vascular space, but I'm not going to ruin it. This is an episode you absolutely have to listen to. If you want to be in medical device sales, or you're not sure, or maybe you're in a different type of medical sales and you're thinking of transferring over to medical device sales, and you've always thought, if I was to make that kind of move, cardio is where I want to be, then again, this is the episode you absolutely have to listen to. As always, we do our best to bring you guests who are doing things differently in the medical sales space. So I really do hope you enjoy this interview. So Shockwave, talk to me.
Yes.
What do you do? What do you sell? What's Shockwave?
So Shockwave is intravascular lithotripsy, and Shockwave is the first company to commercialize intravascular lithotripsy, and it's been out for around, I think, 8 years at this point. Started in the peripheral space, and I have a peripheral background, and I'm a nurse as well. And so the reason why I like Shockwave is because it's safe and it's effective for the patients. Besides that, the culture in the company is amazing. I always wanted to work for this company, which is why I took a territory far away from my house, just to be able to have the opportunity to bring this technology to the patients. So I also learned coronary along the way, which I did not have any coronary experience.
Wow. So you know, a lot of people are listening right now that have no idea what it is you just said as far as what you do. Can you break down exactly what that is, the type of person that does it, and take us into the day of the life of the kind of rep you are?
Okay, so I'll give you a background on myself first. I am a peripheral vascular nurse, and so that's what I've done in my nursing career prior to joining industry. And so I ended up working with interventional radiologists and vascular surgeons, interventional cardiologists, all treating these patients that have peripheral arterial disease. And so there's different treatment algorithms that all these different physicians have for these patients. And it's really mainly about wound care, wound healing, and improving quality of life for these patients. And so as a nurse working in these centers, I worked with a lot of very sick patients, and they would have wounds on their toes that were not able to heal. Mm-hmm. And so the data for somebody that has an amputation for mortality goes way up once they have that amputation. And I worked with these patients, all the time. They would return back to us every 3 months because they were on dialysis and they had dialysis access. So I got to know them and see the fear of them, losing a toe, which doesn't maybe sound like a big deal. Oh, it's just a toe. You have 9 other toes. It's okay. But, nobody wants to lose a part of their body that's supposed to be there. So, we would go and we would assess these patients and check the blood flow down to the feet. And if there was a blockage, we would go in to help this patient open up the blood flow to get down to the arteries that would feed that part of the foot or, ankle, wherever that wound was, to allow this person to heal that wound so that they could prevent an amputation. So I really enjoyed doing that. And I had about 4 jobs. I had a full-time job, and then I had per diem jobs, and I would see all the reps in the room and didn't really understand what they did. I saw them standing there, and I'm going to be very honest, I didn't think they did much. I was like, they're just standing in the back of the room. Why are they here? They buy us lunch sometimes. They would educate us a little bit.
Sure.
But they said to me, everywhere I go, I see you. Why don't you come join industry? And so I thought about it, and then I spoke to a friend who I worked with. He was a radiology technologist, and he had
Yeah,
left the center to go
yeah.
work for an atherectomy company.
Industry. Yeah.
And he told me, this is what we actually do. And so he became my mentor, and I ended up joining. And I said to myself,
Wow, what a
worst case, I
blessing.
could
Look
go
at
back.
you. Wow.
Yeah.
So hold on. I got okay, so that's a cool story. Take us you got to take me to the moment where you said, "Wait a minute. Oh, what? You know what? On second thought, I think I'm doing this." Take it what did you hear? What did you learn? Take us there.
I'm going to be very honest with you. So like I said, I had several jobs. Clearly, I was financially motivated as well, working so
Sure.
many different jobs. And
Sure.
so somebody had mentioned to me there was a possibility to combine the income of all my various jobs into one. And it wasn't going to change my life, but it would just
Right.
be a better work-life
It would
balance, right?
simplify your life and make it a little bit more, straight-laced. I get it.
Exactly. And so that's what I did. I said, you know what? Consolidate, right? Four jobs into
Right.
one. And now I
Right.
get to help bring this technology that I actually believed in to the patients. And I became a clinical specialist. And
Wow.
like I said, I had my mentor. I was never thinking about sales. I just was happy to be a clinical specialist.
So
And
let's talk
yeah.
about that. Let's hang out there just for a moment. Especially nowadays, I feel like the clinical specialist role has been brought to the forefront so much because so many clinicians are now making these kinds of moves. And there's a lot of talk around what does it really mean to be a clinical specialist? And there's talk around different companies kind of redefining what it means to be a clinical specialist. Why don't you explain to the audience how you define the difference between your traditional medical sales professional and your clinical specialist?
So what I find now the trend to be is that clinical specialists are incentivized more to sell, but their main focus is to become the product experts, the disease experts on what the product is treating, and then be able to go in with their expertise and train the physicians, train the staff on number one, the problem that they're solving. Why are they representing this device? And so, what does this device do? Because I know myself as a nurse, and when I was a clinical specialist, I was very interested in learning why are we doing this to this patient? And so that's kind of what the clinical specialist role is to provide that support and be that product expert, troubleshoot, make sure that you're doing things on label, that it's the right option for this patient. And just, if you're in a center where, they maybe only do two of those procedures a day, and then you're going off and you're doing another six, your knowledge of that procedure and just the different treatment algorithms, you see different physicians doing it different ways, different staff efficiency. And so you kind of just become a person where you want to bring value and add, you know, better outcome for that patient and a better patient experience and a better experience for the people that are using the devices.
Right. So that's thank you for that. But in the beginning of what you just explained, you did say that they're being incentivized to sell more than ever. So then, can we say here on this podcast that a clinical specialist is very much a seller?
They should be.
They
Yes.
should be.
Yes. There's certain roles though. So I work in the peripheral vascular space. It's a cardiovascular space. It's an extremely competitive space where there are other spaces and they may have no competitor. You're the only device that solves that problem. So your need to sell isn't as strong as when you're working in maybe a more competitive space where there's a lot of me too products. Maybe this
Okay.
product does this better than the other, but if you're
Sure.
working in a space where you're the only solution, you want to be able, that means it's a novel technology and you want to be the expert
Mm,
and you're leading, changing the world, and you want
yeah.
to teach people how to do this brand new procedure correctly.
Mm,
Sometimes as a
yeah.
clinical specialist, you will scrub in,
Yeah.
not in my field though.
Oh, so you don't ever scrub in?
Not in the peripheral vascular space. No, we do not touch the patients. We do not scrub in. We will do hands-on demos, but non-sterile.
Sure. Sure.
Or if you're selling something like intravascular ultrasound, you're manning the device maybe to do the measurements and things like that, but you're never
Sure.
really taking care of the patient at that point.
Okay.
So you
Okay.
don't have to have a clinical background to become a clinical specialist.
So let's and that's look, you're perfect, Gina, because I was literally going to ask you my next question. So what do you need to have to become a clinical specialist? So then, so then a lot of talk is, and I'll just be real, the optics from our point of view, right? We've had hundreds of people go through our program every year, and we do see that clinicians, nurses, PTs, OTs, SLPs, the list goes on, they really have a good time acquiring clinical specialists compared to other specialties. With that being said, in our program, we've actually had a few bachelor only degree professionals become clinical specialists. Can you give us a little bit of insight into what are we really seeing and how does it really work as far as who can become a clinical specialist versus who can't?
I think that the number one trait that you should have as a clinical specialist is, I guess, maybe compassion or empathy, right? You have to understand that you're working in the medical field, even though there is a push to sell. There's a patient on the table. So that's number one. Whether you have a clinical background or not, understand that there's a patient on the table. Then understand again your product. So you do not have to have a clinical background. If you're somebody that's eager to learn, then learn about the disease, learn about the product. I mean, right now, the internet, ChatGPT, you can learn so many different things. Just ask a question and then it will guide you, and YouTube. So you can become an expert without that clinical background. But so you want to be somebody that's very flexible, somebody that is willing to work hard and be comfortable being uncomfortable. So you have to be able to go to strangers, doctors, staff, and to go up to them and, introduce yourself without anybody else introducing you. So there's an aspect to it that you should be able to, have conversations with people that you are not familiar with, that you're uncomfortable, and they will have objections. You need to be trained on the objections, with your company should train you on that, and have that real conversation. Don't just
Mhm.
go in there trying to vomit everything out that you
Right.
learned.
Right.
Listen.
So, right. So then let's talk about it. So, you're a nurse and you became a clinical specialist through the nurse route. But now that you've had the job for a while, you've seen people come in that were not nurses. And that's why you're able to speak about this. What Let's talk about it though. If I'm a bachelor degree professional, and that's it, my bachelor's was in marketing. I have never taken a science class, let alone a medical background. And I'm competing against your doppelganger, and they're also a nurse, and we're going for this clinical specialist position. What do I bring to the table to even be considered equal to you?
So I feel that that would be your drive. How much do you want to learn, and understand that you're helping to solve a problem. So whether or not, somebody that was a nurse, just because they have a clinical background or a radiology tech, doesn't mean that they're going to have the right kind of personality.
Sure.
It's not like you have to be, oh, so well liked that everybody's your best friend, but
Sure.
you are now a guest in that hospital, or you are a guest in that outpatient center. So you need to be able to have some etiquette. So it doesn't mean just because you have a clinical background that you're going to have that proper etiquette,
Right.
and,
Right.
be able to be professional as well. So, as long as you have passion for what you're doing, whether you have that background or not, and you have the drive to consistently learn, I think that you can be successful and then
Okay.
work your way up the
Okay.
way I did.
Okay. So then I'm going to ask you another question. So again, that same analogy, me
Hmm.
versus you for this position. You're the nurse. I'm just a bachelor's degree professional. What do I need to showcase in the interview process to make them say, "Man, we really like Gina, but this Samuel, he's not a nurse, but oh my gosh, the things he's talking about and showing us, we see them the same." What are those things that I'm talking about and showing them for them to say that?
That you're a go-getter, that you can out hustle me. You want to
So
be able
so
to.
you're saying in the interview process, I'm not even bringing up medicine. I'm sticking to whatever demonstrates that I'm this incredibly resilient, don't take no for nothing, gonna go and do it again and over until I get the results I'm looking for. As long as I clearly demonstrate that I got that going on, you're saying that just the medicine in general can be overlooked.
Yes, I am saying that.
Wow.
There's a lot of athletes that, college athletes, high school athletes that do very, very well in these roles because they learn
Clinical specialist.
discipline. I'm sorry?
Wow. As
Yeah.
clinical specialists.
And even then move on or get direct roles into medical device sales depending on what they
No, no,
went
no,
to school for. Yeah.
I'm speaking strictly to clinical specialists.
Oh yeah. Oh yeah, because you have to know how to win as a team, lose as a
Okay.
team, how to
Okay.
improve. You have to
Okay.
practice. So athletes are excellent in that role. We find them to be very
Wow.
successful. Hmm.
That's fantastic because especially now, what I love about the 2020s is people are really educated on what it means to be in medical sales, not where they need to be to actually get them to the right place, but they're just way more than they were before. And they actually say things like, I heard about this clinical specialist role. It's much more consultative. I'm not a nurse or I'm not a PT, but gosh, I'm really good at that kind of consultative style selling. That's what I want. And you're saying that someone like that doesn't have the kind of background you have is very much in line to get that kind of position as long as they can show the grit that we're talking about.
Correct.
All
Correct.
right. That's cool.
Yes.
That's
And
cool.
then,
All right.
it will depend on the company. So then there's
Of
also
course.
things, it could be about who
Yeah.
you
Because
know.
always, always. So take us into the day of life then. You said you don't scrub in, but you did describe some other things you do. I know your days can look different, but give us, your if you need to give us a couple of variations, go ahead. But what is your typical day that involves everything you do? What is, when are you waking up? What are you going? What are you doing? And when are you ending the day?
Okay, so currently I'm covering peripheral vascular products and coronary. So there's a big difference in peripheral vascular treatment compared to coronary. You can do 20 coronary PCIs in a day, where maybe you could do 5 peripheral vascular procedures in a day. So first thing I'm doing is I'm planning out my week ahead of time. It's not really a day-to-day thing. We're not really on call. So say I'm waking up at 5:30 a.m. every day. I am not going to the gym. I am not a morning gym person. I am an evening gym person, which is why sometimes I don't go. So wake up 5:30, just check the emails. I always check my sales from the day before, see if anything's come in, see if there's anything to do email wise. And then I'll get up, and usually we'll have first case starting around 7 a.m. Right now in my current role, we're only covering hospitals. Outpatient centers tend to start sometimes a little bit later, but hospitals, get there for 7 a.m. You want to be there on time. So I'll know where I have cases, and I have a clinical specialist that I work with. So we'll plan ahead who's going here, who's going there. And so I go and I make sure that the hospital has the product that they need that I'm working with. I get a little bit of a background on the patient so that I could, help this doctor make the right choices. And so I'll just jump right into a procedure. If it's a 7 a.m. start time, maybe then 7:30 the procedure actually starts. And it depends. If it's a coronary PCI, like I said, there may be 20. So PCI could take about 45 minutes for the case. I stay throughout the whole case. I pay attention to the case. I'm not on my phone. I'm there to be present in the case and be a partner for the case. And so I'll continue that through the day. Say there's an hour or two break in between. Since I'm a sales rep now, I will go and maybe make a sales call to some, if I know that there's a doctor nearby or their office is there, try to be very efficient with my time, then go back, do more cases. Could be that, a couple cases in the morning, then I have a lunch meeting with a whole doctor's office or an in-service, which an in-service would be where I would bring the actual demo device and, talk about it. But really it's in a conversational way, not just going there, look at what I have and not listening. What kind of patients do you treat? What do you find? Are there any
Mhm.
issues, this, that? And then determine if I can actually help this physician. And
Okay.
so any day can go on till 5, 8, 10 o'clock at night. It really depends, on what you're treating and what you're doing, but it's very
Whoa,
variable,
whoa,
and you need
whoa.
to be,
Gina, did you really just say, yeah, you're taking it at 5, 6, 10? Just depend. Hold on. You
you
can't, no.
have to be flexible. Yes.
Okay, give us remember, a lot of people are listening that just have no clue. So give us a little bit of context on what you mean by why your day can end at 5 and why your day would end at 10.
Okay, so the peripheral vascular side, which is, very, very passionate about, but say those procedures are getting done in an OR and the start time is 10. Now that room is needed for an emergency situation. It's a trauma hospital, and now that patient gets pushed back till 3. So now you're like, okay, it's pushed back till 3. And then they're like, okay, no, it's actually pushed back till 7. So you have to
Mm.
find, you were planning on doing that case at 10 a.m. and now it's not going off till 7 p.m., but you told that doctor
Right.
you would
Yeah.
be there.
Wow. Yeah.
It
Yeah.
depends,
Mhm.
some products you have to be there for, some products you don't. It depends, if you have a good relationship with your physician and your child has something that night, maybe they'll understand that you can't make
Sure.
it, but you want to be there for the patient and the staff and the physician. So that's one example of how your day can
Yeah.
just get totally flipped upside down.
And so when that happens, do you leave that account to go sell other accounts in the in-between time?
So the good thing about the company that I work for, like I said, is we have coronary and peripheral. So I may go over to the cath lab then if I was waiting in the OR
Mm.
and get in some cases or talk to any physicians in the cath lab, maybe plan some educational dinners. There's always something to do. Education is a big part of my role. So I'm constantly planning educational dinners with speakers for
Sure.
staff or for
Sure.
fellows,
Sure.
things like that. So I may leave, I may stay in the same hospital. It depends on where you are too and where your
Gotcha.
territory
Yeah.
is.
Yeah. It's a lot of variables. So tell us what you sell one more time.
So I sell, it's called IVL,
Hmm.
intravascular lithotripsy. So it is a balloon-based catheter that goes inside people's arteries, and there are emitters on the balloon catheter. And so basically the emitters interact with the saline and the contrast inside that balloon. And
Mm.
so you put it to where the calcium is inside an artery, and then you would inflate that balloon. You're not stretching the artery. The balloon is really just a conduit for
Sure.
those emitters to interact with the saline and contrast inside the balloon,
Okay.
and it creates sonic pressure inside that
Mm.
balloon that
Hmm.
emits out into the vessel. Calcium is very, very hard to treat, especially hard to treat safely because there's always chance of embolization. Think of calcium, an eggshell, a seashell, things like that that are inside your arteries, which
Mm.
make your artery non-compliant. Your artery
Sure.
is supposed to pulse, and then when it
Sure.
becomes hard, it can't pulse anymore.
Right.
So the lithotripsy creates microfractures inside the calcium in the arteries, superficial and deep. And so it's the first of its kind that really can treat the deep calcium. And so why do we want to do that? Because you want to create those microfractures so that the vessel can be more compliant and you can have a larger lumen to get the blood to flow down to where up or wherever it needs to go. So the reason why intravascular lithotripsy is interesting to me is because it's safe. So it does not create embolization. So that's why I'm
Mhm.
very proud to work with it.
That is amazing. I love that. And you said it's been around for 8 years.
I believe about 8 years Shockwave has been around, and then it was just acquired by Johnson and Johnson last year.
Ooh. Oh wow. So you work for Johnson and Johnson now.
Yes.
Okay. Okay, Miss Johnson and Johnson. I did not know that.
Very happy,
That's
yes.
amazing. I hope you're enjoying today's episode. And I want to let you know our programs cover the entire career of a medical sales professional. From getting into the medical sales industry, to training on how to be a top performer in the medical sales industry, to masterfully navigating your career to executive level leadership. These programs are personalized and customized for your specific career and background, and trained by over 50 experts, including surgeons. Our results speak for ourselves, and we're landing positions for our candidates in less than 120 days in top medical technology companies like Stryker, Medtronic, Merck, Abbott, you name it. Would you run an Ironman race without training and a strategy? You wouldn't. So why are you trying to do the same with a medical sales position? You need training, you need a strategy, and you need to visit evolveyoursuccess.com, fill out the application, schedule some time with one of our account executives, and let's get you into the position that you've always dreamed of. What is the competition like in this space?
Okay. As of right now, we do not have any competition that is out commercially yet, but we know that we have competition coming. It's just
Sure,
been taking a little while for these other startup companies to be either acquired or to
sure.
commercialize. But because it's such a safe and effective technology, there's bound to be competition, and that's fine. We welcome it because it's just proving the effectiveness of this technology. So as of right now, we don't have a direct competitor, but there are competitors such as atherectomy devices, which are either, say, laser based or a bird type of atherectomy where you may shave the
Okay.
calcium. So, there's different benefits to different products that you can use.
Now, with those reps, are you guys friends? Are you guys like, oh, they're he or she is, or is it just kind of like they're in their world, I'm in mine? We don't really interact that way. How is it?
Okay. In my space, in especially the peripheral vascular space, extremely competitive. Ooh, can you hear
So,
me?
now I can hear you. So like
Okay.
you guys are plotting on each other and hiding each other's bags and gloves. Like what's happening?
So it's not that bad, but you're definitely maybe not sharing so much information with your competitors. You want to keep some information that you have close to your chest. But really, my mentor taught me this from the very beginning, and I take this with me now. And
Mhm.
I don't talk ill of other people's products and of other reps or anything like that. The goal is really to elevate yourself, elevate your product, and why it may be the best choice in certain situations. And so to be reasonable and understand that, again, these are patients, right? So you can't just go around and try to get the doctor to use your
Yeah,
product just
yeah,
because you're in a competitive environment. You
sure.
want to
Yeah,
really do what's
you'll
best for
lose
the patient.
credibility. You'll lose all your credibility going and bashing any of your competitors. So your mentor
Exactly.
absolutely knows what he's talking about. That's good.
Exactly.
That's
So that's
good.
how I operate as well.
I love it. I love it. Okay, so let's switch gears a little bit. I want people to know the kind of money they can make in this space. And I'm not going to ask you to broadcast your salary to the world, Gina, but give us a range of like entry level. What are you looking to make? And then let's say you're doing this for 5 years and you're the best. What bracket of income are you earning? And what can you aspire to?
So now that would depend on the clinical specialist role versus the sales role, right? So clinical specialist, even for nurses coming in as a clinical specialist, you may not be taking a pay increase. It may just be a lateral
Sure.
financial move, but you're going to have a different lifestyle. So say 100,000, a hundred
Okay.
and fifty thousand,
Okay.
right? Some can make 200,000. Right.
Okay.
So that may be the range. And then there are clinical specialists that do even more than that. And
Okay.
like I said, that's because they're incentivized to also sell. So the ones that can
Sure.
sell, you know, you think of yourself as a clinical specialist as somebody joining a local business, right? It's your territory manager, it's you, and you own a share of that business. So
Sure.
you want to be able to represent your business well, and you want to be able to grow it. And then you're going to be
Mhm.
rewarded financially.
Growing it. Yep.
Right. So then as a sales rep, again, there's a lot. I see even people messaging me on LinkedIn with various medical device ranges from anywhere from $90,000, which they call OTE, on target earnings, for the first year total. And I mean, I know somebody personally that said that they have done as high as 750,000. It's rare.
Wow. As a
It's
clinical specialist
No,
in
no,
your
as a
in,
sales rep, as a sales
okay,
rep.
okay. Yes, yes, we know. I'm speaking to what's this, what are the expectations for specifically your space for sales reps versus clinical specialists?
I mean, yeah, for the sales reps, you would in the peripheral vascular space or the coronary space, I would say, ranging anywhere from 200, and then again, it depends on really the
Who,
company that you
where,
work
what
for.
incentives?
Yeah,
Yeah.
yeah. But
But it can go as
you
high
you
as 7.
I've heard. I know
Okay.
somebody
No,
that
it
did
is what
that
it
much,
is.
yes.
And then for clinical specialists, 2, up to
I,
2.
I've slightly more than two, but that's the
Mhm.
exception. But on average, I would say 140 if you want to throw
140.
an average number out there. Yeah.
Sure. Now, when it comes to just navigating your career, and for that ambitious sales rep or clinical specialist, in the peripheral vascular space that wants to be a manager, and then a second line leader, and then maybe go into in-house and then become a third line leader. Is that a common pathway? Or do you say that when it comes to peripheral vascular, most reps stay reps because they just love the job and they love the money and they love the activity? Or is there a defined track that most people try to pursue?
No, there is not a defined track. So it's the same thing as me becoming a nurse. I thought I wanted to be a nursing home nurse, and I
Sure.
ended up becoming a peripheral vascular nurse, and I was in the medical ICU. So
Right.
I ended up on a path, and I enjoyed it, and then it led me here. And the same thing can happen in medical device. So you don't know what you are good at or what you like until you're doing it. And so certain companies will emphasize different things where my company emphasizes medical education.
Mm,
I have found that I thoroughly, thoroughly enjoy
right.
educating everybody, but
Okay.
specifically fellows.
Okay.
So eventually, maybe towards the end of my sales career, when I feel
Okay.
done, because there is a
Okay.
certain thrill to the sales that you don't want to leave that,
Yeah. Yeah.
I could
Yeah.
see myself going into a medical education role,
Oh,
you know?
you just planted seeds, Gina. That's fantastic. That is fantastic. Okay. Okay.
So yeah,
Cool.
you could go the managerial route, you can go
Yeah.
education. I've seen people go
Yeah.
to marketing, different,
Okay.
yeah, it depends.
That's very cool. Very cool. I love it. Okay. So if I'm listening to this and I'm thinking, okay, I love everything Gina's talking about, I'm going to find out more, everything I can about this kind of rep. Do I go with peripheral vascular rep? Do I go with vascular rep? What do I go around asking people who they are, what title to get the most accurate and most insightful information about what it is you do? Who am I asking for?
So it would be a cardiovascular or
Cardiovascular.
peripheral vascular. So
Okay.
there are some people that are defined as vascular reps where it may not even be as a competitive space. So endovascular, I should say, right? Anything where you're making a little hole in the femoral artery or the radial artery, and then you're treating that patient endovascularly. It's a very saturated space, and I would definitely talk to people in that space. So again, balloons, wires, atherectomies, closure device, IVL, things like that, intravascular imaging, anything like that. Talk to those people because you're going to get a completely different answer than somebody
Sure.
that's maybe working in the structural heart space, where
That's
there's
that.
set times for cases and you have to be there for those cases as a structural heart clinical or rep.
Thank you for sharing that. That's the kind of differentiation that people need to hear. That's fantastic. Okay, so this is what you do. How long you been doing this, Gina?
So I have been in the medical device space since 2018.
Okay. And you've been doing specifically peripheral vascular for
So for 7 years now.
7 years. Okay. Okay.
Yeah, I feel comfortable in that space. I'm very passionate about it. And sometimes I think, oh, should I go learn something else?
And you're like, no.
I got the coronary side now with Shockwave, so I'm happy to learn, but I'm
Okay.
happy to always stay involved with the
Stay
peripheral.
stay stay somewhat committed to the cardio.
I love it. I love it.
Okay. That's awesome. That's awesome. All right. So tell us, what we're gonna switch gears just a little bit. Tell us what makes a phenomenal peripheral vascular rep. Now, I don't want you to tell us what makes a medical device sales rep. We know that.
Hmm.
There's 250 episodes we can find that out. I want to know specifically with the nuances to your space, what makes maybe top three things that make a phenomenal, record breaking, president club earning, patient impact changing for peripheral vascular rep.
So I was lucky enough to get two President's Club awards. And so I'll talk about my direct experience of what I did, right? It
Okay.
was my very first sales role. And so I just took the knowledge that I had about peripheral vascular. So if you don't have that knowledge, you need to learn it, right? You need to know what the anatomy is. So you
Sure.
have to know what you're looking at on the screen, and you need to know the whole flow of how a typical peripheral angiogram goes, right? So observe those procedures, get into those procedures, know them start to finish. They're always going to be different, but they're always going to pretty much start and end the same with access and then closure. So you want to know the procedure and you want to know the disease state, right? So then while you're there talking to your physician or covering a case, if you're in the room and you're looking at the camera and you're seeing what's on the screen, you want to know what you're looking at, okay? Because they're going to turn to you and say, "What do you think? Do you think this would work here?" And if you don't even know what artery you're in a lot of trouble. So you
Right.
need to know
Yeah.
the anatomy, and then you really should also have an idea of the physiology, right? So if you use this device, this could be the outcome. Maybe your device isn't the best, and you should tell the doctor that. I think that maybe this would be better. Don't
Sure.
be afraid to
Yeah.
lose a sale to
Yeah.
help the patient.
Credibility. Yep. It's all credibility.
Exactly.
Yep. Yep.
So I mean, that's huge, is to become that
Mhm.
trusted advisor, actually know these
Mhm.
procedures. So that
Yeah.
was my tip to a clinical that I had brought on. I said, just watch the procedures, learn the language, and
Mhm.
learn the algorithm. They all have
Mhm.
some kind of
Sure.
algorithm.
Sure.
And you really need to know your device. You need
Mhm.
to know the capabilities, you need to know
Sure.
the limitations.
Yeah.
So
Yeah.
if they turn to you and say, "What are the specs of this device?" and you don't know it, they're asking you for a reason. It may not fit through that size sheath.
Mhm.
It may not
Mhm.
be compatible. So now you open it, you open a couple $1,000 device and you put it on a table and it doesn't fit through the sheath. And now you look silly because you didn't pay attention. Oh, he has a 5
Mhm.
French sheath in there. My device only goes through a 6 French sheath.
Mhm.
So you want to be able to know your device and how it can be delivered and if it will fit in the arteries. So that's that. And I guess one more thing is, don't ignore the staff, right? Because you should try to educate everybody and let them know why this is being done to that patient, because you're going to build allies in that lab that are believers in your device and the reason why your device is used. And when you're not there, they're going to help suggest it if it's proper for that patient. So you would find the alpha people in the room and let them know what's going on, and so that they could be a voice when you're not there.
Very well said. Thank you, Gina. Okay, we're gonna switch gears one more time before we wrap this up for today. So, how do you make this happen? Are you a family woman? Are you a solo rep out there just doing it? Kids, how are we doing this? Tell us the
I don't
personal. Give
know
us as
how I'm
much as you
doing
can.
it.
Give us as much as you can about the personal life, and what does that look like? And how do you make it all work with this medical sales career?
Yes. So I will say that I got lucky that I got into this when my youngest was about 10 years old. So I didn't have little kids. So I give a lot of props to the people that do it with little kids.
Sure.
But so I'm a mom, I'm married, and I have 2 children
Okay.
who live very, very full and busy lives. My daughter is an all-star cheerleader, and
Okay.
it's crazy because we are traveling like every other weekend
I
from
believe
Friday
it.
to
I
Sunday, doing
believe it. How old?
competitions and things like that. So she's 17, and then
Oh
my
my
son is
gosh.
21.
Oh,
Yeah.
wait. So you're like, this is your senior year. You're done. You're just about done.
I'm just about done, but she said now she might go for cheerleading for one more year on some
Oh,
famous cheer
okay.
team because she's
Okay.
really good, but I'm not going to hold her back. But I love it, but it's a lot because the job is a lot, but you
Mm.
just have to be able to balance your time and prioritize. And you cannot forget so my old manager gave me the biggest tip that I really take with me all the time is, do not get too high on the peaks and don't get too low in the valleys, because it's very easy to do that in this
Mm.
field. And I get sometimes emotionally tied to how I am performing in my territory. And so that's hard. My husband also is
Right.
in the medical device field.
Whoa,
So,
you guys
yeah.
are just powerhouses. Wait, what space is he in?
So he's also in peripheral vascular.
What
He's
the
a nurse
hell? This is
practitioner.
not fair. You guys should not be allowed. You guys are dangerous.
It's fun. It's fun.
You'll
Yeah.
kill your competitors. They got nobody
We
has a chance.
definitely, no, we definitely help each other out, and
That's
we find a lot of
amazing.
joy in that.
Now, was that by design or that just happened?
Well, he was going to school to be a nurse practitioner while I got my first role in medical device, and he was
Oh
watching all of the
man.
things that I was learning, and he said, "You know what? I want to do that." And so
Oh, you can't
when
make
he
this stuff
graduated,
up.
yeah.
Wow. When's the book coming out?
I know. So I
That
know.
is
And now our children may
awesome.
want to get into it as well. So we'll see.
Real talk. Out of all the guests that I've had, I don't think this has been a thing where husband and wife are in the same exact field to the point that they can, mentor each other. You can't ask for, like, that's the best situation.
It's really amazing. I don't know if you've ever watched
Congrats to
Talladega
you.
Nights, but Shake and Bake with Ricky
Yes,
Bobby, and
yes, I have seen Talladega
sometimes we
Nights.
feel
Yeah.
like that. Yeah.
Wow, that's amazing. That's amazing. We're gonna have to have like a whole nother episode just about that dynamic, but not today. Well, you know what, Gina, this has been fantastic. You're clearly living a phenomenal career. You clearly love what you do, and you're changing patients' lives. And thank you for just everything you've shared with our audience today.
Absolutely. Thank you. I'm a huge believer in anybody that wants to get into this, you can find your way, especially with programs like yours. I did build a website that is called Nurse Elevator, where nurses and techs can come to, and then I would direct them to people like you to
I
help
love
find
it.
their way
Nurse
in. So,
Elevator. I love it.
yeah.
NurseElevator.com.
Correct. Yeah.
Okay,
It's a little empty
NurseElevator.com.
because I'm very busy working, but it's
Yeah.
a work in progress, and they
Hey,
can come visit. If they send me an email, I'll get it.
it all has to start somewhere. That will be in the show notes, folks. So we're gonna do one more thing, Gina, before we end today. Are you ready?
I'm ready.
This is the lightning round. I'm gonna ask you 4 questions. You have less than 10 seconds to answer. Here we go.
Okay.
All right, Gina. What is the best book you've read in the last 6 months?
Influence by Robert Cialdini, The
Oh, that's
Psychology of Persuasion.
classic. Bona
Yeah.
fide classic. Okay. What are the best TV show or movie you've seen in the last 6 months?
I'm currently watching a series on PBS called A Brief History of the Future. And I really suggest that everybody watch this. It's on
Whoa.
PBS. PBS.
Okay. Okay.
I learned about it on an Andrew Huberman podcast, right? Now it's
Sure.
about learning about utopia, where how you can be a positive change in the world and in your family. And there's so much dystopia that's sensationalized. If you look at the news, everything's negative and people fighting. So this is kind of allowing people to know, like, it's okay to be a positive influence and you don't have to get involved in all the negativity. And A Brief
Ooh.
History of the Future.
Okay. That will be in the show notes too, folks. I'm gonna have to check that out, and I'll give you an update. Okay. Best restaurant. Sorry. Best meal. We want the restaurant, we want the location, and we want the item that you've had in the last 6 months.
Okay, so I was just in Dallas this weekend with my daughter at a cheerleading competition, and we went to a place called Pecan Lodge, and I had the brisket and I had mac and cheese, and it was absolutely amazing barbecue.
Peak. So it's a barbecue joint.
Yes, Pecan Lodge in Deep Ellum.
Pecan
Yes,
Lodge.
yes, Dallas, Texas.
Okay. Okay. Awesome. That will be experienced. And then the last but not least, what's the best experience you've had in the last 6 months?
Going back to this weekend, it's actually my best experience in these past 6 months was immediately following the worst experience in probably my almost my life. Was there was a active shooter situation at the cheerleading competition that I was just at. They are saying there was no gun, but could not get in contact with my daughter because she was at warm-ups. She was trampled. All these terrible things happened. Couldn't find her. Somebody gave her the phone. I was able to know that she was okay. About an hour later, got to finally physically see her. We ran to each other like a movie and hugged, and that was the best experience in the past 6 months, even though it was a terrible experience to just
Wow.
be able to connect like that. It was
Wow.
crazy.
What a blessing. My goodness.
Yeah,
You know,
so life is crazy.
if they went to us when we were 17 and they said, when you have a 17-year-old, the concerns you'll have is active shooter at your cheerleading competition. Like, could you imagine even
I was
who would
sitting
have
there
thought that
waiting for
that's
her.
something we'd have to.
It was one of the happiest moments waiting for her. And then when we got the phone call and they told us, get down, run out, it was crazy. Never thought I'd be a part of it, but thankfully I'm here and she's here and nobody was hurt. Well, people were hurt. I'm lying. They were trampled and things like that, which I
So,
hope that they
so
recover okay. But
I
yeah,
want to ask a few questions if I can about this experience because this is. I mean, I'm assuming for both of you, life flashed before your eyes. So
yes.
now, so let me ask you. I got two questions then.
hmm
Before this happened, you and your daughter close or not so close?
We're close. She's my best
Close.
friend, but she
Okay, you guys are
still is a
close.
17-year-old girl.
Right.
So
She has to be. She better be.
I'm also her worst enemy.
Right, right. But after this though, I mean, a new dynamic has been opened up. What's different now?
I guess just I feel like she saw me more as a human that day, than more so than even her mom, because she was genuinely concerned about my well-being. The first thing she said to me was, "Are you okay? And are the other
Wow.
moms okay?" And so
Wow.
it was special to hear that. You don't want to hear that, but I was like, wow, she cares about me as a human. And so yeah, we definitely went through this together. It was definitely life-changing. And you know, we've been through some other stuff in our, losing a
Sure.
family member to cancer and stuff, but
Mhm. Yeah.
this was something we were very fearful for our own
Mhm.
lives and
Mhm.
each
Yeah.
other's, and yeah.
Man, you two got have angels watching you, and thank you for sharing that with us. And what a blessing that things turned out okay.
Yes, thank you so much.
Absolutely, Gina, it's been amazing. We can't wait to see all the amazing things you go on to do with your career, and keep us updated.
Thank you, Samuel. Very nice to do this with you. Thank you so much.
And that was Gina Torres. Fantastic stuff. The cardiovascular space really is growing. A lot of innovation there. Clearly, exciting lives are being lived in this space. Listen, if you've heard this episode and you're thinking, this is what I want to do, then you know what I'm going to tell you. Visit evolvesuccess.com. And more importantly, if you're listening to this podcast right now, you better subscribe. Subscribe on Spotify and subscribe on Apple because these are the kinds of episodes that are going to educate you, inform you. It doesn't matter if you're trying to get into medical sales or you're already here. This kind of episode is what's going to let you know what you can just transition into regardless. I hope you enjoyed today's episode. And remember, I have a customized and personalized program that gets you into the medical technology industry as a sales professional or any type of role for that matter. Become a top performer in your position and masterfully navigate your career to executive level leadership. Check out these programs and learn more at evolvesuccess.com by visiting our site, filling out an application, schedule some time with one of our account executives, and allowing us to get you where you need to be. Stay tuned for more awesome content with amazing interviews on the Medical Sales Podcast.